Today's topic is radiology of the head neck region. There are several types of radiological images. Some are plain radiological images. Some are contrast radiological images. Contrast image and plain images like plain X-ray. At your level, only the plain X-rays of the head and neck region, they are very important, and for your examination, just remember those X-rays that those are plain radiological X-rays. Among them, you can get, so the X-ray source might be from the back, from the front, from either on the right or left lateral side. Okay, accordingly we can get the several images. So most common images we can find, that is the view of the X-rays. Why posteroanterior view? Why not anteroposterior view? We can see in other region of the body, like in the superior extremity, inferior extremity, we get AP view, anteroposterior view. Only in the chest we get PA view. Again, in the head neck region, this is what we can see, that is the PA view. Why not AP view? If the light source is coming from the front, we can get the image, but where is the fallacy? Where is the problem? Can anybody tell me? Using your common sense. Very common. Just use your common sense. Why not the AP view? কৌশিক স্যার ওখানে দেখাচ্ছে, দেখো স্যার কিন্তু একবার একটা ইশারা দিয়ে দিলেন, একবার দিয়ে বন্ধ করে দিয়েছে, আর দিচ্ছেন না। স্যার এরকম করে দেখালেন, স্যার এরকম করে দেখালেন, eyeball, the most precious organ of special sense that will get affected, immediate cataract formation. Okay, so in that case, in some case we have to do, but we have to use the shield. That is the lead shield we have to use in some special condition. Otherwise, this is the PA view. What we can see it here, the PA view of the skull. You can see this is the bony skull, which has got outer table and the inner table. In between we can get চেয়ার নেই নাকি? চেয়ার নিয়ে নাও, এখানে চেয়ার আছে, নিয়ে নাও। In between we can get this, in between inner and outer table we can get trabecular tissue. Okay, trabecular meshwork like structures we can get, that is the we can get, and here we can get the the impression of the sagittal suture also sometimes. And in between to frontal bone we can get metopic suture, appearance of metopic sutures. Okay. Metopic suture, sagittal suture we can expect. And here we can get the frontal bone, and here within the frontal bone we can get the black shadows. Black shadows are due to any air. You have seen in the chest, the lung, wherever you will get the air, you will get a black shadow appearance. Similarly, here we can see what we can see on either side. There is the frontal air sinus. There are so many sinuses around the nasal cavity. They are called paranasal sinuses. So this is one of them, that is the frontal air sinus. We can also get the maxillary air sinus. We can get the ethmoidal air sinus. Okay, we can see the ethmoidal air sinus here, and here we can get the black shadows, that is the ethmoidal air sinuses. And also we can see sphenoidal air sinus, but not in this view properly. We cannot delineate exactly the sphenoidal air sinus, but here we can see the nasal septum. Okay, we can see the nasal septum here. Okay, and here also on either side this circular shadow, this is the orbit. The image of the orbit. Orbit means where we can get eyeball and extraocular muscles, nerves, vessels, so many things. Okay, that is the orbit. পরীক্ষায় একবার জিজ্ঞেস করেছিলাম অরবিটটা কোথায়, সে খুঁজেই পেল না। এখানে না, ন্যাশনালে। অরবিট কোথায় বাবু, কোথায় অরবিট আছে? অরবিটটা শুধু দেখাও, পাস করে যাবে। সে অরবিট আর দেখাতে পারলো না, খুব দুঃখ হলো। শুধু আমার না, ডক্টর আসাদ ছিলেন, ওনারও খুব দুঃখ হয়েছিল। ডক্টর মানে অনেক সিনিয়র আসাদ স্যার, কি গো তোমরা অরবিটও দেখাও না সৃজিত? আলাম যে দেখাই না তাহলে। So that is the orbit where we can see the image of the orbit. Okay, and here we can see other things like this is the mandible. Okay, ramus of the mandible. Okay, and condylar process we can get, and also here we can get within the orbit a bony shadow. Horizontal you can see there is a bony shadow. That shadow is due to this, contributed by a part of the temporal bone, that is Petrous part of the temporal bone that will appear in the orbit also. Okay, and on either side the ethmoidal air sinus, and you can see the nasal septum. Nasal septum, the bony part is contributed by perpendicular plate of the ethmoid and the vomer. Rest of the things are cartilaginous. Okay, there are the major contribution by the ethmoid and the vomer. So they will appear radio opaque. So that is the nasal septum. Okay, and on either side here we can get the maxillary air sinus. We can see the denture, we can see the soft soft tissue shadow of the tongue. We can see the soft tissue shadow of the tongue. So these are the important features. Symphysis penti, we can see the base of the mandible, ramus of the mandible, and ultimately the condylar process. So here we can expect the level of temporomandibular joint. Okay, but with PA view we cannot comment. Okay, we should not comment. Now, this is the lateral view of the skull. Lateral view. In the lateral view, we can get so many other things. We can get here, we can get the coronal suture. Here, পরের ভিউটা বোধহয় একটু ক্লিয়ার আছে। Yes, এটা ঠিক আছে। Here we can get sometimes the coronal suture. Okay, coronal suture we can get, and here similarly we can get the diploe tissue. What I was saying, in between the outer and inner table we can get the diploe tissue. Okay, clavicular bone. Okay, flat bone is there. Okay, in between we can get diploe tissue, where we can get diploid vein, which communicates the extracranial and intracranial structures. Okay, scalp and the intracranial structures. The third layer, remember, loose areolar tissue. Scalp, what is the different layer of the scalp? S for skin, A for aponeurosis, Gallia aponeurosis, L for loose areal layer tissue, that third layer, that is a dangerous layer. That is a dangerous layer because there are some emissary veins, diploe veins are there, which communicates the extracranial and intracranial structures. Intracranial, within the cranium, there are the dural venous sinuses are there. Okay, within the endosteal and meningeal layer of the dura, we can get like আচ্ছা একটা ইম্পর্টেন্ট বলো, there are so many dural venous sinuses, just but mention only one important one. Cavernous sinus, very good. Cavernous sinus, which is very important, and cavernous venous sinus thrombosis is a bad clinical condition. So we can get outer and inner table, and here we can see, this is here we can get a depression, and depression looks like is a saddle shaped depression. Sella Turcica, pituitary fossa, it is meant for the pituitary gland, or Sella Turcica. Turkish saddle like bed, okay, Turkish bed. So that is the pituitary fossa. We can get the pituitary fossa, and here we can get there we can get a white shadow. This white shadow is nothing but the petrous part of the temporal bone, and also we can get a black shadow, external auditory meatus, external auditory meatus. Why petrous part of the temporal bone is important? Bolo, tell me why the petrous part of the temporal bone is important. Come. Why petrous part of the temporal bone is important? Asho, Asho. Please come here. Why the petrous part of the temporal bone is very important for us? Very useless part of the useless cranial bone. What do you think? The petrous part of the temporal bone, why it is important? Bolo, bolo. Huh? Arey Baba. Why the petrous part of the temporal bone is important? Where we can get the house of inner ear and also middle ear. Okay. So here there we can get external auditory meatus and internal auditory opening. Okay. So that is the petrous part of the temporal bone where we can get middle ear and also the internal ear. So if that part is affected, what will happen? There is one condition which is the cholesteatoma formation, where this part is affected. Okay. And behind we are getting, behind we are getting again a black area, that is the shadow. এই শো তো অর্ধেক হয়ে গেল, তুমি কি করবে? হ্যাঁ, মানে পেট ভরে খাচ্ছিলে নাকি? খাওয়া দাওয়া বেশি হয়ে গেছে না? ট্রেনটা মানে লেট করেছে। বায়োকেমিস্ট্রি ক্লাসটা মানে টিফিন আওয়ার ক্রস করে হয়ে গেল নাকি? আর এরা কেউ নেই, বায়োকেমিস্ট্রি করছে না এরা। তো যাই হোক, this is the area where we can get again black area, like honeycomb appearance like area, that is the ethmoidal, that is the mastoid air cell. Mastoid air cell, if that area is replaced by fibrous tissue, that is also a pathognomonic sign, that is the pathological. Okay, that shows there is formation of the cholesteatoma. Okay. Now we can get other things also, whether like frontal air sinus, we can get the vascular markings over the cranium, and also here we can get the cervical vertebra, and the cervical vertebra, the first vertebra is nothing but the atlas, and within which we can get the odontoid process. Odontoid process is coming from the second cervical vertebra, that is called axis. Okay, Atlantoaxial joint. So we can get the Atlantoaxial joint, and we can get Atlanto-occipital joint. Two joints are very important, Atlanto-occipital and Atlanto-axial joint. Okay, joints of yes and joints of no. পরীক্ষা আছে, আমি আর যাচ্ছি না। So from here we can count the different vertebra, first, second, third, like that. Though this appearance is not very clear. So here we can see the dens. Okay, the out limit of the dens we can see. So this is the second. third, fourth, like this. There are 7 cervical vertebrae. Now here we can see the black shadow is nothing but the maxillary ear sinus. We can see the maxillary ear sinus. Okay, and the ramus of the mandible, and here we can get the head of the mandible or condyle of the mandible, and this is the temporal bone. So that is a temporomandibular joint we can get here. Okay, and this is nothing but the external auditory meatus. Okay, so these are some important features you have to remember. And in front we can get the dentures. Okay, we can get the pituitary fossa, and here we are getting again a black shadow within the body of the sphenoid. So that is nothing but sphenoidal ear sinus. So this is nothing but the sphenoidal ear sinus. Okay, and in front we can get the ethmoidal ear sinuses. Okay, and this is nothing but the maxillary ear sinus. So paranasal ear sinus. Why paranasal ear sinuses are important? They are the ear conditioning chambers. ঠান্ডার মধ্যে যখন তোমার নিঃশ্বাস নিচ্ছ তখন কি হচ্ছে, it goes within that paranasal sinuses, and you can get the proper conditioning of the air, and ultimately that air will go inside. তুমি নিলে আর চলে গেল তা না. So within the paranasal sinuses, this air is reconditioned. So there are frontal ear sinus, maxillary ear sinus, ethmoidal ear sinus, and here also we can get the sphenoidal ear sinus. We know sphenoethmoidal recess we have seen in the sagittal section, okay, of the head and neck. So that sphenoidal sinus and ethmoidal sinus we can get, they open, and the ethmoidal ear sinuses has got anterior, middle and posterior group. Okay, and you must remember anterior is and middle, they are opening where? Middle is opening, we have seen the bulla ethmoidalis, the middle, anterior within the middle meatus, posterior we can get in the superior meatus. Okay, so anterior, middle and posterior group of ethmoidal cells. Occipitomental view, OM view, where we can see the paranasal sinuses properly. This is again we can see frontal ear sinus, maxillary ear sinus. Here we can get the ethmoidal group of ear sinuses, and here also we can see the soft tissue shadow of the tongue, and also this white bony area which is not very much prominent in this picture, that is not here. We can get the appearance of the dents, that is the we can get the axis, okay, where we can get the dents. Okay, so that is occipitomental view, a meatal view, we can see this one. Otherwise we can see it is more or less same. Okay, so maxillary is very important for the maxillary and the frontal ear sinus, which are very commonly affected. In your clinical practice you will get either maxillary sinusitis or frontal ear frontal ear sinusitis. Okay, so these two sinuses are very much clearly seen, and here we can see the horizontal mark. This is nothing but the petrous part of the temporal bone. Nasal septum we can get, ethmoidal ear sinus we can get, frontal ear sinus, maxillary ear sinus. Okay, and within the you can see the orbital, which is called occipitomental view or water's view. Water's view, you must remember. So all the plane X-rays are important for you. None of the contrast views are important. Now you can see this is the lateral view, and here we can see the atlas or the first cervical vertebra. Atlas means it holds the globe. So this is the atlas. Then we are getting the second, that is the axis. This is the dens. Dens is going inside the atlas. Now third, fourth, fifth, and so on. And intervertebral space, and here we can get intervertebral foramina. These are nothing but the intervertebral foramina, and in between two space, two vertebrae, we are getting intervertebral disc, the shadow of the intervertebral disc. Okay, that if that area is becoming smaller and smaller, so that is a pathological condition. Okay, and also we can see this. You can see this cervical vertebra, which is projected in front. Okay, these parts are projected in front. Okay, sometimes we can get the bony spars. That is also a pathological one. These are the spines. Okay, transverse process we can see, and we can get the intervertebral foramina. Intervertebral foramina. So this is the, and also we can see the mandible. Just below the mandible, this bone is nothing but hyoid, body, lesser cornu and greater cornu, and here we can get the greater cornu. Here we are getting the lesser cornu of the hyoid bone. That bone gets fractured in case of hanging and throttling.